it's Scott. And I want to go ahead and just quickly geek out for a couple of minutes and touch on central lines, specifically triple lumens. Now, for many of us, especially if you work in the ICU, but also in the ER, on the big people side, if you're septic, you're shocky, etc., on a regular basis, your doc is going to go ahead and pop in some sort of a central line. And many times that's going to be some variation of a triple lumen. However, this is kind of neat because a little while back at one of our skills labs, a fellow educator went ahead and donated an expired triple lumen catheter for us to play with. And from my perspective, having been a nurse now for over 30 years, this was actually really cool. Because I've taken care of countless patients over the years with these devices, but honestly, I've never had the chance to go ahead and actually look at one up close outside of the body and go ahead and figure out how this whole triple lumen thing actually works. Okay, so when it comes to a triple lumen, which remember is just like a double lumen, and it's just like a single lumen. Lumen just simply means you've got a tube. And in this case, you've got not one, not two, but three different tubes going down into the patient. And commonly, whether it's a kid or an adult, these are placed, you remember, in the neck, the chest, or the groin. And there is central line, meaning their end point is going to be somewhere inside of the chest. And whether that's in the vena cava or in the right atrium, the goal is to get them into the center of the chest in a big old vein so that way lots of blood can happily go round and round. So when it comes to the triple lumen itself, couple things. First of which is, remember, you've got three different colors. You've got white, you've got blue, and you've got brown. And with that in mind, if you work in the ICU and you do this every day, we simply say that we know that white is proximal, brown is distal, and blue is medial. However, if you forget which is which, that's okay. The easiest way to do it is simply close up, read the actual tube. It'll tell you white is proximal. It will tell you that brown is distal, meaning all the way down, and blue is medial, or the monkey in the middle, meaning it's the one in the middle. Now, why that's important is if you look right here, you'd imagine that if you followed it up, that the one in the middle would, of course, be the one in the middle, otherwise known as the medial. But for whatever reason in healthcare, it's not that way. So you're trying to remember white is proximal, blue is the middle, brown is distal, meaning all the way down towards your bottom, or in this case at the bottom of the tube is where you're going to find your distal port. Now, one other quick thing though, and that's remember all central lines have some variation of these things. And these are just for safety. Even if you've got some sort of a cap on here, which you absolutely should have, if you're even thinking about getting anywhere near opening this port, meaning you potentially get a blood pouring out or air flying in, make sure before you open it that you go ahead and clamp off the tubing. And that way, your chance of having something inadvertently in or out is a whole lot less. But interestingly, if you look here, this is how a triple lumen actually works, is it has three holes. So if you notice towards the tip, the first hole you see about 2 inches from the end on the adult catheter, right here is going to be your proximal. If you follow it just a little further down, the monkey in the middle, right here is where you're going to have your medial hole. And all the way down at the end is where you're going to find your distal tip. So that's how you've got a triple lumen. You literally have three different lumens or three different tubes with holes for the fluids to come out. So as you can see, we've got three different fluids. We've got clear fluid to show where the proximal is going to come out. We've got blue hooked up to the blue to show where the medial fluid is going to come out. And we have brown coming out the bottom, otherwise known as the distal port as well. We saw that we had distal over here, we had medial or the middle right here, and as we go all the way proximal on the tube, we have your proximal port way down here. So when it comes to triple lumens, remember lumen just simply means tubes. So when you've got a triple lumen, you've got 3 tubes. When you have a double lumen, you've got 2, and a single lumen, you've got 1. But either way, when we put in some sort of a central line, it's typically in kids just like adults, we place it in the neck, the chest, or the groin. And the idea being that it winds up somewhere inside the chest. And whether that's in the vena cava or the right atrium, the idea being that once this big old catheter is inside of the right spot, we've got a whole lot of blood moving, swishing, going round and round in that area. And that way, with this catheter, we can infuse not 1, not 2, but 3 different drugs that normally, if you put them together, would create cement. Case in point, if you mix calcium and bicarbonate, remember you get calcium carbonate, otherwise literally known as chalk. So with that in mind, that's why these catheters are so helpful, because you can give these nasty drugs into big old veins, allow lots of blood to happily go round and round, and even if the drugs are incompatible, you can infuse them into different lumens and do what you need to do.